I am 60. Should I try Dermapen? Nervous about numbing process and possible infection from the holes in face. Is this worth it for sagging skin and some age spots?
Thank you for your question. You're basically asking that you're stating in a question without a photo that you're 60 and should you try a Dermapen. And you're concerned about some sagging skin, some age spots, and you're concerned about possible infection from the small holes that are made. Well, certainly I can give you some perspective on this question, even though you didn't provide a photo, and how I use Dermapen and microneedling in our practice. A little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and providing solutions for facial aging issues and improving skin is something we do every day, all day long in our practice. So I think that first let's talk about the technology of dermaneedling. And basically, dermaneedling is to create fine holes in the skin that are very, very small. And it's basically with the idea of a concept called collagen induction therapy. Those tiny holes will elicit a healing response. And what I usually do with microneedling, or frequently do, is the application of platelet-rich plasma, or PRP. This is derived from your own blood, and it's used to help facilitate the healing and even stimulate more collagen. But I think before you think about dermaneedling specifically, think about the global concern that you already expressed in this question. You're talking about sagging skin, which means to me, given the age you provided, age 60, sagging skin, I don't think microneedling is actually a good solution for sagging skin. It's about improving skin texture and quality and color, but it will not tighten the skin at a level that will cause a lifting effect, which I think a lot of times people are looking for when they describe sagging skin. For that, there are other options that you can explore, whether it's limited facelifting or suture suspension or some type of repositioning type of procedure. If you want to avoid surgery, well, you have to think about other possibly thermal energy devices to try to non-surgically tighten the skin, but I'm not sure those are going to deliver the results that you want either. When it comes to age spots, the brown discolorations that are associated with the history of sun exposure and that come up as people get older, there are definitely many ways to address the age spots. There are, besides microneedling, there's also any type of laser device that does something to either disrupt the pigmentation or resurface the skin, can provide a solution for the age spots. So when you think about microneedling, I think it's possibly because you want to try to do something that's as minimally traumatic or minimally invasive, and certainly will improve the texture of your skin. But understand that a single treatment is not likely to be able to achieve the full potential of what you're looking for with your skin. So I think that discuss with the physician who recommended this in more detail what the outcomes will be before you just go ahead and do this. Again, sagging skin will not respond significantly to microneedling. Sagging skin requires some type of device, or some type of method, I should say, to tighten the skin, reposition the skin, or a combination of both. So, but when it comes to age spots, you have options. You can do things that are a little bit more aggressive but may give you faster results than microneedling. If at a minimum you won't have necessarily the same experience, but you might get comparable results depending on the type of brown discolorations you have. So I hope that was helpful. I wish you the best of luck. Thank you for your question.